aka nitro in acute cardiogenic pulmonary edema. Age, greater or equal to 18 years. Weight, none. Level of awareness, none. Heart rate, 60 bpm to 159 bpm. Respiratory rate, none. Systolic blood pressure, normotension. Other, none. What are the contraindications for nitroglycerin aka nitro in acute cardiogenic pulmonary edema? Allergy or sensitivity to nitrates, phosphodiesterase inhibitor use within previous 48 hours, SBP drops by 1/3 or more of its initial value after nitroglycerin is administered. What is the dosage for nitroglycerin aka nitro in acute cardiogenic pulmonary edema when SBP is between 100 mmHg and 140 mmHg with IV or history of nitroglycerin? SL dose, 0.3 mg or 0.4 mg. Dosing interval, 5 minutes. Max number. Sign of doses, 6. What is the dosage for nitroglycerin aka nitro in acute cardiogenic pulmonary edema when SBP is between greater or equal to 140 mmHg with IV or history of nitroglycerin? SL dose, 0.6 mg or 0.8 mg. Dosing interval, 5 minutes. Max number. Sign of doses, 6. What is the dosage for nitroglycerin aka nitro in acute cardiogenic pulmonary edema when SBP is between greater or equal to 140 mmHg with no IV or history of nitroglycerin? SL dose, 0.3 mg or 0.4 mg. Dosing interval, 5 minutes. Max number. Sign of doses, 6. What are the 5 classifications of aspirin? Antiplatelet, antithrombotic, anti-inflammatory, antipyretic, analgesic. What are the pharmacodynamics for aspirin? Inhibits the formation of thromboxane A2, which is a potent platelet aggregate and vasoconstrictor. What is the onset of aspirin? 15 to 30 minutes. What is the duration of aspirin? 4 to 6 hours. What is the classification of epinephrine? Sympathomimetic. What are the pharmacodynamics of epinephrine? A1 receptor, vasoconstriction, B1 receptor, increase heart rate and force of contraction, B2 receptor, moderate bronchodilation, inhibits histamine release, positive chronotropic, dromotropic, and inotropic effects. What is the onset of epinephrine via intravenous? Immediate. What is the duration of epinephrine via intravenous? Unknown. What is the onset of epinephrine via subcutaneous/intramuscular? 5 to 15 minutes. What is the duration of epinephrine via subcutaneous/intramuscular? 1 to 4 hours. What is the onset of epinephrine via inhalation? 1 to 5 minutes. What is the duration of epinephrine via inhalation? 1 to 3 hours. What are the classifications of nitroglycerin? Antianginal, nitrate. What are the pharmacodynamics of nitroglycerin? Relaxes vascular smooth muscle, and dilates both arterial and venous vessels, decreases the preload on the heart as well as myocardial oxygen consumption. What is the onset of nitroglycerin? 1 to 3 minutes. What is the duration of nitroglycerin? 30 minutes. What is the classification of salbutamol? Bronchodilator, sympathomimetic. What are the pharmacodynamics of salbutamol? Selective B2 stimulation equal bronchodilation and some degree of vasodilation, some B1 effects especially in repeated doses, little to no alpha stimulation. What is the onset of salbutamol? 5 minutes. What is the duration of salbutamol? 3 to 8 hours. What are the indications for the medical cardiac arrest medical directive? Non-traumatic cardiac arrest. What are the conditions for CPR in the medical cardiac arrest medical directive? Age, N/LOA, altered HR, N/RR, N/SBP, N/other, performed in 2 minutes intervals. What are the conditions for manual defibrillation in the medical cardiac arrest medical directive? Age, greater than / equal 30 days LOA, altered HR, N/RR, N/SBP, N/other, ventricular fibrillation or pulseless ventricular tachycardia. What are the conditions for epinephrine in the medical cardiac arrest medical directive? Age, N/LOA, altered HR, N/RR, N/SBP, N/other, anaphylaxis suspected as causative event, IM route may be used. What are the conditions for medical TR in the medical cardiac arrest medical directive? Age, greater than / equal 18 years LOA, altered HR, N/RR, N/SBP, N/other, arrest not witnessed by EMS and no ROSC and no defibrillation delivered. What are the contraindications for CPR in the medical cardiac arrest medical directive? Obviously dead as per BLS PCS, meet conditions of do not resuscitate standard. What are the contraindications for manual defibrillation in the medical cardiac arrest medical directive? Rhythms other than ventricular fibrillation or pulseless ventricular tachycardia. What are the contraindications for epinephrine in the medical cardiac arrest medical directive? Allergy or sensitivity to epinephrine. What are the contraindications for medical TR in the medical cardiac arrest medical directive? Arrest thought to be of non-cardiac origin. What should be considered for treatment in the medical cardiac arrest medical directive? CPR, supraglottic airway equal where more than OPA/MPA and BVM are required and without interrupting CPR, manual defibrillation, epinephrine equal if anaphylaxis is suspected as causative event of cardiac arrest. What is the manual defibrillation treatment for a patient aged greater to or equal to 30 days to less than 8 years? Dose: 1 defibrillation initial dose, 2 joule per kilogram subsequent dose, 4 joule per kilogram dosing interval, 2 minutes max number sign of doses, N/A. What is the manual defibrillation treatment for a patient aged greater to or equal to 8 years? Dose: 1 defibrillation initial dose, as per BH/manufacturer subsequent dose, as per BH/manufacturer dosing interval, 2 minutes max number sign of doses, N/A. What is the epinephrine treatment for a patient aged greater to or equal to 30 days to less than 12 years given via IM? Dose, 0.01 mg per kilogram max single dose, 0.50 mg dosing interval, N/A max number sign of doses, 1. What are the indications for the trauma cardiac arrest medical directive? Cardiac arrest secondary to severe blunt or penetrating trauma. What are the conditions for CPR in the trauma cardiac arrest medical directive? Age, N/LOA, altered HR, N/RR, N/SBP, N/other, performed in 2 minutes intervals. What are the conditions for manual defibrillation in the trauma cardiac arrest medical directive? Age, greater than / 30 days LOA, altered HR, N/RR, N/SBP, N/other, ventricular fibrillation or pulseless ventricular tachycardia. What are the conditions for trauma TOR in the trauma cardiac arrest medical directive? Age, greater than / 16 years LOA, altered HR, N/RR, N/SBP, N/other, no palpable pulses and no defibrillation delivered and monitored HR equals 0 or monitored HR is greater than 0 with closest ED being greater to or equal to 30 minutes. What are the contraindications for insertion of a supraglottic airway? Active vomiting, inability to clear the airway, airway edema, stridor, caustic congestion. What are the indications for croup? Severe respiratory distress and stridor at rest. And current history of urdy and barking cough or recent history of a barking cough. What are the conditions for epinephrine in croup? Age, less than 8 years LOA, N/HR, less than 200 ppm RR, N/SBP, N/other, N/P. What are the contraindications for epinephrine in croup? Allergy or sensitivity to epinephrine. What is the treatment for a patient with croup who is less than 1 year old and less than 5 kilograms via NEB? Concentration, 1 mg per milliliter equal 1,000 dose, 0.5 mg max single dose, 0.5 mg dosing interval, N/A max number sign of doses, 1, add 2 milliliters of saline. What is